thank you very much for your contribution to our study of the impact of COVID-19. I can't resist continuing the conversation about data. So I think I'm going to go back to Dr. Wong, if I may. And in fact, in your presentation, you did say, you talked about systemic issues, and you did say we need a national health data system. So I'd like to explore that a little more with you if I can. And you were, at the end of your response to Senator Moody, you were beginning to talk about national standards as well. We have heard a lot, by the way, about LTC management data systems and the importance of having a national management system. So if you could help us understand, obviously these are things that have to be considered in a report about the government's response to COVID-19 and what recommendations we can make going forward. So I would be really happy to hear what you could tell us further about these two issues. Thank you.
Thank you, Senator. What I'm going to say in terms of this reference to a national health data system is an opportunity for us to put in such a way that the data can actually drive some of the decision making rather than a simple tick box exercise. So I'm not trying to be too negative about current systems that might be in place, which involve a lot of quality assurance. But when it comes to quality improvement, opportunities must arise from this data collection that allows for improvement more than a little tick box. Let me share with you some on-the-ground experience when you talk to practitioners and staff in long-term care, for example, that being a pressure point significantly that is on mastering COVID-19. The notion of someone coming in with a clipboard and a little tick box sheet of paper can be very overwhelming and scary for staff who are already working, running off their feet and trying to say, what do you mean I need to meet these 10 extra little boxes? That's not the system that I'm making reference to. When I talk about a national health data system, I'm talking about, for example, things that are already happening in Europe. So for example, when I look at Britain, and when I look at now, clearly, the national health systems in UK clearly has some pressure points. Not trying to say that we want to replicate those pressure points. But one of the newer directions when it comes to big data, and we talk about the data science, the data analytics, is how do you capture real-time data that is going to be available to not just the practitioners, but also folks who are helping to make decisions when it comes to resource allocation, policy division, and so on, so that they actually have this data to work as a premise. That currently is not available. Even when data is collected, it is stored magically in this big black box that somehow is almost next to impossible for people to have access in a ready way.
I'm just going to unmute myself here. What about, you talked also about national standards, and if you could please, again, this is something that requires federal government regulation or some such thing. If you could please elaborate on that, that would be good. Thank you.
Thank you, Senator Seidman. What I'm talking about, and full disclosure, I'm a medical and health educator. So in the UBC Medical School, I'm the senior education dean. So the way I look at it is, it would be nice and important for our federal government to take on a leadership position at a national level to set the benchmarking. The word accreditation comes to mind, but it's about setting those standards nationally so that they can be implemented at the provincial and territorial level. There is a precedent in doing this. This is exactly how most, if not all, of the health professional programs, training programs work in Canada. There's a national accreditation body setting the standards, and then individual provinces, territories, schools, colleges, etc. implement, and there's a regular exercise of continuous quality improvement. That's the analogy that I would use, is what we need for long-term care.
That would be right across the board for all the particular classifications, positions, descriptions.
Correct.
There are a lot of descriptions of different kinds of jobs in long-term care. So you're saying right across the board.
Correct. And very quickly, just to augment on that answer, recognizing the heterogeneity in the public-private sector involvement in the country, these standards would have to apply across the board, because otherwise there's a risk of creating a second-class or third-class kind of arrangement.
Thank you. Do I have any more time, Chair?
Just a very quick minute if you want to use it.
I do a quick minute because my real question that I wanted to ask Dr. Wong, but then I got into the data issue, was it has to do with this expert task force on long-term care. And when I asked him this morning, Dr. Régent Hébert, who was with us, said that he too is on this task force. But, you know, there's been very little public information available about it. And I was wondering if you could just help us understand its official mandate, who's part of it, what is the time frame, when do you hope to be finished your report?
What I can say is the task force on long-term care for the government of Canada is convened by the Chief Science Advisor, Dr. Mona Niemer from Ottawa, and it involves an expert panel from across the country. Most of the initial work has been completed. We have submitted our report to government, and my understanding is it's sitting within the federal government. We clearly agree that key messaging from the reports should be shared and communicated effectively. We are currently waiting for the government to take the next steps.
Thank you very much. I think my time is up.